Hey guys, it's Dr. K. So first things first, I'm super excited to be back in the mix. The new baby's growing bigger and bigger every day. And that means she's needed a lot of my attention up to this point. But here on out, I'm getting closer and closer to being back on my own schedule to give you guys the great advice you've come to expect. So what I wanted to talk about today was how do you actually know if your clinician is relying on, the best science available to get you better and back to doing the things you love with the people you love. Any clinician worth their weight, they're going to actually take the time to listen to your story, they're going to evaluate your symptoms, they're going to figure out your current level of pain, and make sense of your movement habits and any of your limitations, and they're definitely going to take into account, how that's affecting your strength and your balance. Now, these are all important factors that help them develop a working diagnosis. Now, I can't stress this enough. Just because you have knee pain does not always mean that the pain is coming from your knee. So that clinician needs to be thinking above and below that problem to figure out what's limiting your function. Now that first visit is the most important visit for you as a consumer, as an active adult, to help you decide whether or not you actually want to work with that clinician. I want you to really think about how they spend their time with you during that initial exam, and I want you to ask yourself, did they really take the time to examine what's going on with me? Did they help me determine what my goals are? Did they come up with a customized plan to help me reach my very specific goals? Were they really, even empathetic towards my needs? Did they seem honest with me? Did they look me in the eye when they talked to me? Or did they have their back turned to you the whole time while they're typing away on a keyboard? I've been in your shoes too, and those are situations I've come across as a patient that have frustrated me. So if you find yourself in a clinic where they develop a plan for you that involves all the voodoo passive therapies out there, like ice packs, hot packs, ultrasound, laser, I want you to do yourself a favor. I want you to find another place to go to. Those are all treatments that may temporarily reduce pain or inflammation, but they're not therapeutic in and of themselves. They're not going to fix or solve your problem. It's a band-aid on the problem. I don't know if it's that clinicians and doctors figured out it's an easier way for them to address pain while seeing more patients, or if they've just become lazy once they've graduated from school, not willing to go the extra step to learn more, to be willing to help their patients. There are a lot of variables involved with developing and understanding of a person's individual needs and coming up with a customized treatment plan for them. These variables are all important and they change from person to person. They're very specific, but what should not change is that whatever treatment is recommended is evidence-based, drawn from clinical practice, and it's tailored to your individual limitations and goals. You should be active and incorporate strength and mobility exercises and include ways of developing your skills to take care of yourself in the long term. It's not always easy. You may not use the hottest, newest toys or incorporate a fad that's on Instagram or TikTok. I won't lie to you, it requires a lot of work on your part, but you have to put in the work to get the results you want. And a clinician like myself is here to help guide that process. The best thing I can do for a person after I help them achieve their goals is to actually teach them to be self-reliant so that they don't have to invest, their time, their energy, and their money to come see a person like myself unless it's absolutely necessary down the road. So, my process isn't necessarily a best fit for everybody, but I'm here to give you an honest assessment about what it takes to achieve your goals. If you feel like you have some questions based on this post, by all means, give us a call, shoot us an email, let us know how we can help. We love solving difficult movement-based problems. So, I'm celebrating your success already. Stay strong, inspire others.